Let's go through hyperthyroidism. We're going to start, as always, with the pathophysiology. So, in hyperthyroidism, we have an overproduction of the thyroid hormones T3 and T4. To get more detailed, in hyperthyroidism, there's an overproduction of TSH. TSH causes the body to produce T3 and T4. And because of that overproduction, we end up with too much T3 and T4. The most common cause in the pathophysiology of hyperthyroidism is Graves' disease. Graves' disease is an autoimmune disease, just like if you already watched the hypothyroidism lecture, you saw that over there it is most commonly caused by a different autoimmune disease, Hashimoto's. In this case, it's Graves' disease. Two other common causes are a toxic goiter or an adenoma. All of this results, again, to summarize the patho, all of this results in increased metabolism, increased metabolic rate of nearly all of our body systems. So what happens? Signs and symptoms, we have high temperature, high heart rate, high blood pressure, high energy level. We do have weight loss because the body's burning off a ton of energy. We can end up with diarrhea, insomnia, exophthalmos, which is a bulging of the eyes, and restlessness. Looking at the diagnostics, we look at the TSH. That's the most common test that we use to assess for thyroid disorders, either hypo or hyper. And in this case, don't forget, if you've seen previous lectures, TSH is an inverted lab, meaning that in hypothyroidism, the TSH is going to be high, and in hyperthyroidism, the TSH is going to be low. T3 and T4, those are the actual thyroid hormones. Those are what execute the functions of the thyroid, and those are going to be elevated in hyperthyroidism. There's something called the RAIU, radioactive iodine uptake test, which is another test that we use for hyperthyroidism. And another test that I didn't put on here is thyroid antibodies, which is another test we can use to test for Graves' disease specifically. We can also ultrasound the thyroid itself. The nursing assessment is very simple because it's going to be exactly what we discussed. It's going to be checking the labs, palpating the thyroid to see if there's a palpable goiter, and also checking the signs and symptoms. If you're not familiar with what a goiter is, it's nodules or other abnormalities that result in an enlargement of the thyroid gland. Next, we look at nursing priorities for the NCLEX. That's going to be airway and breathing and the vital signs. Remember, we said that this can cause the patient to have increased heart rate, increased blood pressure. So we want to, and it can also send the entire sympathetic fight or flight response haywire. So we want to make sure we're really monitoring their airway and breathing, and then their vital signs, specifically their heart rate and blood pressure, make sure all of that stays under control. The treatment for hyperthyroidism is going to be a few different things. First of all, there's something called the thiamide drugs. Thiamide drugs is almost exclusively referring to methimazole and PTU. PTU stands for propylthiouracil. Now, of these two drugs, methimazole is the preferred drug, and these drugs reduce the production of T3 and T4. Methimazole is preferred in all cases except where the patient's pregnant. In that case, PTU is preferred at least for the first roughly 16 weeks of pregnancy. So that's going to be one treatment option. I'm not putting these in any order. Another option would be radioactive iodine, also known as iodine 131. In the case of using iodine 131, this is meant to kill off a part of the thyroid so that there's less production of T3 and T4, so that reduces the reduces hyperthyroidism. Now, whether or not the provider is going to choose to do thiamide drugs or radioactive iodine, or the next option, which would be surgery, is dependent on a lot of factors, well beyond what you would have to know as an RN for your nursing course or the NCLEX. One thing to know about radioactive iodine, as well as the next option, which is surgery, is that in both of these cases, we run the very high risk of the patient ending up hypothyroid, meaning we sort of overshot our target. And now instead of having too much T3, T4, they have too little T3, T4, except that's a preferred option because that's more easily treatable. We replace the T3 and T4, and we do that with giving them levothyroxine, which is Synthroid, and we discussed that extensively in the hypothyroidism video. So the third option, to sum it up, is going to be surgery. That's going to be a partial or complete thyroidectomy where we remove the thyroid. And then the last two boxes, client education, we're going to teach the patient about the disease, specifically about the signs of thyroid storm that we need to educate them about, things like when the heart rate and blood pressure are getting too high, if they're having severe insomnia, restlessness, things like that. Complications, the number one complication is going to be a thyroid storm. This is where there's symptoms of hyperthyroidism, all the same stuff we've been discussing in this video, goes really, really to the extremes. They end up with really high heart rate, really high blood pressure, really high temperature. They end up with extreme restlessness. This is a massive overstimulation caused by the excess T3 and T4. And in these cases, there's a lot of aggressive treatment that's necessary. So these are a true medical emergency. We need to look out for that. Also, left untreated, hyperthyroidism can cause a lot of different issues. It can cause hypertension. It can cause other cardiac issues. It can cause osteoporosis, which is a weakening of the bones. And it could also cause infertility. Those are the big ones that I think you would be tested on in nursing school. There are a few others as well that I could include here. Good luck in nursing school. If you have any questions, please reach out. Otherwise, I'll see you in the next video.